children is suffering dramatically. And I'm seeing that.
Oh,
and
even with the social distancing, I've asked my son, so he's at a school that is a project-based learning school, PBL. They're used to being up and around and working with their groups and moving all over the building. Now they are sitting in the same spot all day long, masks on, socially distanced. The teachers come to them, and he's kind of like, his comment to me all the time is, "Mom, what's the point?"
Right.
And and a lot of his friends are doing online. One of his buddies whose dad's a doctor, he's remote. And my son was like, he goes, at some point he goes, it's almost like I might as well just stay at home. And I said, no, but physically getting out of the house, driving to school, at least that's something. Plus he's able to go out with a buddy to lunch. I think even just scraps at this point. Take what you can get. I
agree. What's interesting is I would think that outdoor play would be a much bigger phase of schools right now.
Like I would, especially while the weather's nice. Go outside. Sit on the concrete, sit in the grass, and have a class outside at least for 30 minutes during the day. And then I wonder, do they still, since I don't have elementary school age kids, this is my question to those of you who do they, at recess, are the kids limited? Can they play on the swings and the slides and stuff like that?
I would think they'd be able to.
Or is that all off limits? And can you not, do you have to stay 6 feet away? And how do you tell a first grader to stay 6 feet away from their best friend?
Well, and again, I think
I'd like to know that from members of the crew who have elementary school age kids.
And I think that outside I don't think it's a bad thing. It's a whole different approach and whole different thing than being inside with recirculated air and all of that.
Right.
And so, Tommy Lasorda, Coach Quigley, shared that Tommy Lasorda was taken to the hospital.
Oh.
He has been upgraded now. He is in ICU.
Okay.
Don't know what it is. Have not heard yet from. Well, don't know yet. Have not heard that from Coach. Of course, Tommy Lasorda, longtime manager for the Los Angeles Dodgers. Especially, I call them my Dodgers during the time because that's when I became a fan. That's when I was a small child when Lasorda had taken over the Dodgers. Yeah. And so a lot of those guys were my baseball heroes. Yeah. When I went to the Sandlot, I was always either, Ron Say or Steve Garvey or Mike Sosa, or I was Ken Landreau, or I was, Don Baylor, or I was, Dusty Baker, or, So always Fernando Valenzuela if I was pitching, because who didn't want to be Fernando Valenzuela, right? Or Jerry Royce, or Bob Welch, So again, big Dodgers fan. So prayers out to Tommy Lasorda and his family, and hope everything is going well there. And
absolutely.
So we have got in studio and seated, might I say, the mental health moment. We've got Steve Dunn and we've got Patty Giolet. I love that, by the way. I love that. So both in studio, Morgan Foundation, Something for Kelly Foundation. They both, I tell you, doing yeoman's work. Had a great event the other night I missed, and I apologize. Became so hyper-focused. Ended up out of town till 9:45. But just real quick, how did everything, give us a summary of how the event went and who your star was that night.
Thank you very much. We had an amazing night, Thursday night. We had Dr. Cynthia Bulick return via Zoom. She started out with a pre-recorded message for us because we didn't know whether or not she was going to.
Hold on 1 second. We want to have the audio on you. Oh.
Plug it in.
Yep. So yes, high tech.
And good morning, Kathy and JP.
Love
your bow tie.
Hello.
Yeah, Steve, tell us how it went.
It went marvelous. Absolutely marvelous.
Still nothing so
well, he's plugging. He's trying to plug you in.
I know, I can see that.
It was a great event because for the first time, thanks to Patty and SFK, there is now collaboration between the treatment centers and this incredible research doctor studying the genetic aspects of this disease.
Good morning. Hey, there it goes.
Hey, there she is.
Good morning, everybody.
Hello.
Thank you, JP.
You're
Yes.
welcome. So Dr. Bulick had a pre-recorded message.
Dr. Bulick had a pre-recorded message because, of course, in the era of COVID, we didn't know what we were going to have or experience. So she gave this amazing pre-recorded message talking about the work that they're doing. But what was most exciting and the biggest event of the evening was that the Something for Kelly Foundation, in collaboration with the Morgan Foundation, reached out to treatment centers all across the country.
So great.
Specifically, we had Dr. Stephanie Setliff from the Eating Recovery Center of Texas. She's the medical director of several of their locations. Stand up, and we asked Dr. Bulick if she could come back on via Zoom live, which she did, so that we could then introduce Stephen Dunn, who then spoke with Dr. Setliff, who committed their resources in Texas to getting their inpatients involved in this study. It was the biggest success of the evening.
This is huge. This is huge in the field of eating disorders.
It really is, Kathy.
I just think about, having the conversations with y'all about this when you first started talking about this research, and for it to come to fruition like this so quickly, this is a God thing.
It really is.
All right, we want to go ahead and thank Acadia Healthcare for sponsoring the Mental Health Moment. For all of your mental health needs, if you are feeling grief this holiday season, if you're feeling anxiety, if you are feeling depression, if you're feeling suicidal, help me out here.
Ideations.
Thank you, ideations. Yeah, I couldn't think. I had idiosyncrasies in my head. I'm like, no,
feel like yourself. Even if you just feel off or just not yourself.
This is a commercial, not a conversation.
I know, but this is but
I know, but talk about
we
it.
don't
in a
have.
second.
We're not in
Contact
studio
Chris
next.
Getz.
We're not in
Contact
studio
Chris
next
Getz.
week.
469-400-7499. 469-400-7499.
Will you say that again? I'm going to put that on our feed.
469-400-7499. And it'll be on the screen as well. Contact Chris Getz with Acadia Healthcare. Whew. Okay. Now feel free to have a conversation.
Yeah, you're doing an actual commercial read. Okay.
Right. And you're
for a sponsor, which we appreciate them so much.
Steve and Patty, that's what you guys have brought to us today.
Today we're bringing to you the roller coaster of life and death and grief and joy. And I made some notes from the past 6 weeks because there's just been, you can't make up what I'm about to say here. So I'm just going to really hit the high and the low points and let's jump right into things. On September 18th, my mom died in a rehab place here in town. Because of COVID, we didn't get to see her since February. And she passed on that day alone. Then we jump forward in time to October 24th, which was the 1-year commemoration date of my dad passing away last year. And then we jump forth in time to October 30th, which is the 4-year commemoration date, Morgan being taken. Well, then we start to get some good things going on in the November 5th SFK event, and I get a call that day from my son's wife saying, I think today's a day I'm going into labor. Great news there. So the event was a great success, and the next day at 7:42 a.m., I get the call, and my beautiful granddaughter has arrived.
Yay.
And she's healthy. Her name is Riley Amelia Dunn, R.E.D.
She's beautiful.
Which those are the initials of my dad's name, of course. And so everything is going just right with the world. And then on Sunday, November the 8th, ERC invited me to talk to a dad's group, and there were 39 dads in this group, and it was such a great experience. But things seem to happen when you least expected. Early that evening, I got a call from Gail, the wife of my older brother Chuck, and she is hysterical because the paramedics have just left with my brother Chuck. Apparently, he had a massive heart attack at home. Granted, this is guy 64, and he's a warrior. He runs marathons and buys and sails his own boats and works out all the time and eats well. So we have that going on. The very next day, we're here with you in studio with Brian Hufford. And he throws a great show on. We talk about the Rick case. That's going to help so many. And, not much else because we don't get much information from Tampa on my brother, of course. And then there's the next day. On Tuesday, November 10th, my son calls and says his wife is having some issues. Her speech is a little bit slurred. There's tightness in her arms. There's swelling in her legs. So he rushes her to the emergency room. Well, that afternoon, about 2:00, we finally get a call from Florida saying my brother had a massive heart attack. His brain is not responding. He's in ICU. And I am told that I'm not only the executor of his will, but the surrogate on his living will.
So you're you're the one to make the medical decisions.
Yes. So perhaps for the second time in 4 years, I'm going to have to tell the medical providers to stop the life-saving treatment. How much fun is that going to be? It goes on. At 3:00 on November the 10th, I get a call from my younger brother who lives in California, who says, I'm in the emergency room right now. I just fell down some stairs. I might have a broken shoulder and back that's messed up. I mean,
oh my
really,
goodness.
you can't make this stuff up. About an hour after that, after I talked to him, I'm holding my granddaughter for the first time. And, of course, the weight of everything and the tears are just flowing. And my son is looking at me because I haven't told him about his Uncle Chuck because I want him to focus on
the baby.
Baby, absolutely. So he's looking at me like I've got a second head growing out of my shoulders. And Patty's there, and she has to go to a different room because she doesn't want to tell him all of this. And so it's just the ups and downs, and I'm feeling both, of course. But then that night, I get an email from one of the dads in the group that I talked to on Sunday, and he said what an enriching life experience it was for him, that Morgan is doing great work through me, that he's been inspired to try that much more. And about 15 minutes after that, we get a call from basically the hospice people in Florida saying, get here as soon as you can. So the tickets are booked the next day. Nothing happens on November 11th, yay. But then on November 12th, Patty and I are in the Uber on the way to the airport when we get a call from Chuck's wife saying, turn around, go home, because the hurricane that everyone thought had died had picked up intensity, had taken a right turn, and it was hitting Tampa.
You can't make this up.
No, you can't. So we of course go home, and by this time the dark humor is just coming out, and I'm telling Patty, of course, this is, my daughter is showing my brother around in heaven, and she said, Chuck, we can do anything we want up here. So Chuck says, well, let's see, and he gives my little brother a push down the stairs just to see. Morgan says, that's all you've got. Hold my beer. Watch this. And she makes the hurricane go off. So on Friday the 13th, we make it to Tampa and talking with the siblings and his wife and all that. The next day, we're at the hospital, November the 14th, and the decision is made. Of course, his brain is dead, but he wanted to be a donor, though.
Oh, okay. Organ donor?
Yeah.
Okay.
So now they're scrambling around trying to find a surgeon to be able to remove the organs, of course.
Right.
And I have to go in, and they have 1,000,001 questions, things like, has he been out of the country? Has he had sex with a person who's been in prison in the last year? I'm shaking my head going, well, I certainly hope not.
I don't think so.
But they have to ask
question?
all of those. Yeah, because of the diseases and viruses and that sort of thing. So at 11 p.m. on Saturday night, the surgeon finally arrives, and they remove the tubes and he breathes his last. But apparently, when the life treating medical devices are removed, you only have 60 minutes for the breathing to stop.
Okay.
If it goes more than that, they won't take the organs then.
Well, because they'd be damaged with the lack of oxygen. Yeah. Okay, that makes sense.
So, of course, he's not going to go out easily in about 65 to 70 minutes pass. And from what I understand, they say that they can't now. So, yesterday, I guess it was, spent the day looking at the will and the living will and talking to his boys and his wife and all that. And we're back in town and the fun has just begun. And it from an emotional point of view, I can't think of any other more extreme measures you can go through. I can tell you the night before we left, we went out and had drinks with Stephanie Satliff. She's become a really good friend, and I didn't know till after the fact that she was performing her nefarious tasks on me and was shrinking my head and getting inside of me and getting me to try to get out of my own way, and gave me the name of a counselor to see, and I come in, okay, yeah, sure, absolutely. Especially because the counselor's name was Jerry Lewis.
But of course.
So we decided to go ahead and have a few drinks with her again last night, and I'll be darned if I didn't give Dr. Lewis a call. I've not heard back from him yet, but I'm sure I will.
Yeah.
And the process begins. And as you said, right before we came on, with the holiday season coming up and COVID coming up, and is your family going to come in or not, there's never been a more important time to get the help you need. You can't be shy. You cannot back away from that. And if a guy like me who believes that I can do anything and everything finally throws his hands up in the air and says, okay, Lord, you made your point. It could have been done a little bit more delicately.
Had to drop a ton of bricks on your head.
And yes, and he did. But this isn't about me. It's not feeling sorry for me. It's simply about getting a story out about how grief and life impact your life and things you can do to get help you may not even know you need.
So true. And I'm so proud to be your friend, both of y'all. For you to come on, I mean, you're a sharp guy, extremely intelligent, successful attorney, but it's okay to ask for help. It's okay.
Absolutely.
And good for you for revealing that in a very public manner. And
I really didn't think about this way until Miss Patty over here brought it up yesterday and said, yeah, Steve, you've had 3 significant deaths in 1 year. And I really didn't even think about that, Patty. Thanks a lot.
Yeah, but you did. Yeah, but you did.
And no matter if you think you're in the best shape of your life, because he was. And when we went to his house, we saw all of the marathon posters he's had, and he's run 13 of them. And so he was a larger than life guy. And JP, if he was standing next to you, let's say, and you asked 100 folks, okay, between JP and Chuck Dunn, which of the two is likely to have a heart attack before age 65? Probably 99 of them would say you, of course. But it's not like that.
When it's your time,
and the likelihood of that for me is very low because my genetics don't say that. My genetics are all this size, and we live in our 80s. And I've told Kathy, and Kathy's like, "Don't say that." And I'm like, "Well, but it's true.
It's cancer.
It's cancer. My family is cancer, and it's late 70s, early 80s."
See, now, do y'all have? Is there any heart disease in your family? And does this make you worry?
Yes and yes. I've got.
No, I mean, not to be Captain Obvious, but I'd be like, okay, should you get it? Yeah, exactly. I'm like, okay, I do know
I'll
CPR.
Jump on your chest, Steve. I'll get that heart restarted.
Well, in fact, on my mom's side, there have been some heart issues. Both of my uncles on her side passed away before age 65. I think even before age 60 from heart condition. So there is that, and of course with Chuck now. So Patty last night was asking me things like, okay, Steve, is your will up to date? And am I included in it? And what are all the passwords? That is something else. People, estate plan. Fill out your directives to physicians, your living wills, and
let somebody know what your what type of service you want. Do you want to be cremated? I mean, all of these things.
Absolutely,
so that way, it takes away an argument. Because I've often thought my mom would probably want, if I were to pass before, her or my husband, she would want things a certain way. My husband would want things a certain way. I don't want them fighting at the end of the day. So I've right there at the dinner table had the conversation of, hey, this is what I want just in case.
Well, that's a very good point, because Chuck has 2 children from a prior marriage, and the fact that he had already created this living will helped tremendously during the conversation about palliative care versus ongoing treatment, and what would he want, and that's very important that was already in place, so that Steve's job as the executor or the surrogate of the living will was made very clear. He just needed to facilitate the choice, and the choice was very obvious. You follow what the person's wishes were. So
it's a member of the crew said they're very sorry for your losses. So
thank you. Also, one thing, and this is incredibly important as well. I'm going to be facing this afternoon. If you're in a marriage relationship, make sure your spouse knows the passwords to your computer, your
Problem
laptop.
is I don't know them.
Make sure that on your bank accounts that you have someone listed as a joint tenant with the right of survivorship, so the bank will just pass the funds on to them. There's got to be someone you trust that you can pass that information on to, because we're looking at a situation where Chuck paid all the bills online. Gail doesn't know how to get into his computer or bank account or pay bills, or she's asking me all these questions, and we're going to work things out, but people, make it easy on yourself. Talk to your spouse. Make sure the passwords are written down. Maybe not those dodgy passwords to those websites that you don't want them to know about, of course. But
clear out your search history. Well, JP said just literally, we were up here on Saturday. We were producing Kilroy's conversation. Oh, and by the way, Gail Meeks of Gail and Steve's show Money Links, she said watch our show on estate planning. Extremely important.
This Sunday at 3 o'clock, and
so
then again at Thursday.
Yeah, so definitely get that out there.
Thanksgiving, 7:30.
But when JP and I were up here with Kilroy's conversation after the show, and I was like, don't say that, but you know what? It's good to know, because he's got all of the information for our network on his laptop. So he said, hey, God forbid something happens to me. He said, I could walk out of here and get hit by a bus. You never know. And he said, this is where you go on my computer to find all the business information, because he's the one who keeps all of that. So it's just simple things like that. You can avoid those conversations down the road. I've got a dear friend of mine. I'm the executor to her will, and or will be when hopefully a long time from now. But she told me that, and she's let other family members know that, so they're not shocked that, hey, if I pass, you know what? It's not a family member. It's a dear friend.
Yes.
So I think that's important.
Again, we want to thank Acadia Healthcare for sponsoring the Mental Health Moment here on JP, Kathy, and the crew. Again, if you find yourself experiencing grief, if you find yourself experiencing suicidal ideations, if you find yourself with anxiety that's overwhelming you, or just need someone to talk to, Chris Getz is your personal concierge at Acadia Healthcare. Look her up, give her a call, or you can go to their website. You can call Chris Getz anytime, 24 hours a day. She is available to you and will answer the phone. Her number, again, is 469-400-7499, 469-400-7499.
Steve, I want to turn the conversation just ever so slightly for the listeners to understand. What you're doing today is really quite brave and raw and authentic, but not everybody can do this immediately afterwards. And in fact, you were not able to do it immediately afterwards when Morgan died. So I do want to put a little bit of perspective around this, because even our dear friend, Dr. Setliff, and I were having this conversation about, is this too soon? Is Steve really ready the next day to come in and be this raw? We had an experience last year at a filming of grief, at a filming of people dealing with grief. And we have come to refer to that day as Tragic Sunday because it happened on a Sunday. And I would like to invite you to share that story because it's not everybody right away. And let's put some perspective around whether or not you should be talking so publicly in the immediate aftermath.
Absolutely, and for me, it was about 3.5 years after Morgan was gone. But there were two other dads there. No, I'm sorry. There's one dad. I'm going to just focus on him. His daughter had been killed in a car accident 3 months before, and this dad gets up there and he said, well, I've had friends come to me and say, it's time to get past your grief and you can do this. And so he's standing there and you just look at him. You can just smell the grief and the pain within him, but he's talking like he's okay and he should be able to give advice. It doesn't work that way. I know that I am just, a hot mess right now. So, but also I believe that grief is not a linear thing. It's not where it's agonizing here and then straight down the line there, it improves. Yes, we get to go on our lives with a more productive way, but it's always with you. And it might be the scent of a flower or a song that just brings it back. But talk about it, though, and acknowledge that it's okay to hurt. Well, I'm in a lot of pain right now. And the difference between, I think, me and this poor dad was he didn't have the support staff around him that I'm lucky to have. Everyone in this room are tremendous support staff. I think it's important as well, when you see a counselor, ask them questions about their background, what evidence-based treatment they provide. If they have been in counseling themselves, you're trusting your heart to these folks, and they had better answer every question to your satisfaction. And if they don't, look somewhere else. It's incredible.
That's a good point.
This is basically a job interview that you're conducting for them on something incredibly important. People ask questions. Do your homework beforehand. Research them so you find out a little bit about them. And if they back away and don't want to respond to that, then they're not the right ones for you. Yeah.
Well, and for years I have said to families, not every counselor fits every family. No. And you really do go in and need to interview them to make sure they're a good fit.
Yeah, if you don't get a good vibe or a good feeling, you know what? You're not hurting anybody's feelings. Just say, when they say, do you want to make a follow-up appointment? Say, I don't. I'd like to know what other therapists are available.
Well, and there's an assumption I think we make as well that if you've got letters behind your name or if you're a professional, then everybody has graduated from the top schools in the country with straight A's. And it's funny, I've always made the comment when I go in and look at a medical doctor, I ask them, what was your GPA in medical school?
Yeah.
And they'll either tell me or they'll ask me to leave. And they're like, well, why does that matter? I said, well, because to be honest with you,
I
don't want to get advice from the guy that got 67% all through medical school. I want the guy that got a 98%.
Yeah, that's a good point. You don't want, the guy who, I passed. Oh, what?
Right. And so it is important to make sure it's a good fit as well. It may not be that they're medically incompetent or they're counseling incompetent. It may just not be a good personality fit for the two people as well. So
that's a really good point to make because it's to your credit. The person could be very professional and have all of the credentials, but Steve, your personality is not going to fit with a lot of folks and the treatment.
What?
But Jerry Lewis it will, though.
This is breaking
Jerry
news.
Lewis
No, seriously.
A great start.
But Chris Chris Gatz, I got her on the mic. I just saw, Chris, because I just saw Katie.
Patty.
No, but Steve,
Hi,
because Steve's
Patty.
He's got a very dark, hilarious, but jacked up sense of humor. You do.
Now it's time to go to commercial
Yeah,
break.
he's a mess.
No, I don't mean
Sponsored
that.
by the darkness.
I do not mean that in any disrespectful way.
No.
But Steve, yourself, you have said for the last few years you would not go to see a provider because you could beat them up emotionally and fight back, and they would not be up to par. And it was really, I mean, this is important stuff. For the last several years, people have advised you to seek counseling, and you demurred. You're like, no, I'm not going to do it. I could walk circles around them. Morgan was the same way, you said. And so I'm just, to John's point, not everybody's going to be a good fit, and you're willing and you're authentic to
John's
be
like,
out
"Get me out
there.
of this."
Yeah, and a lot of that came about. We found that a number of counselors in the eating disorder community are still in active recovery themselves, and they're getting as much out of the session as the people that they are
interesting.
trying
Okay.
to counsel. That is a huge issue in the community right now, that we get these counselors out there who aren't all the way recovered, and as a result, the advice they're giving might not be, and probably is not, the best advice, because they're in some ways treating themselves at the same time.
Well, and I could see, Steve, with as intelligent as you are, and as much as you like to banter, and I could see you end up counseling the counselor.
Oh, interesting.
In all truthfulness,
Yes.
because you will see it and not take
that's very
advantage
good.
in a
That's a good
bad way,
point,
but take
yeah.
advantage in a good way to try to help them, because that's what your heart is.
Oh, yeah.
And yeah,
and you're super smart. That's a problem.
It can be, yeah.
Well, and again, and he's got a very ironic sense of humor, and jacked up,
Iconic?
hilarious, dark sense of humor, and so not every he is iconic. So not every therapist is going to be able to hang with that. They're going to be like, wait, I need to analyze that. No, that's just part of who Steve is. You need to let that part go. Let's work on,
And you know, I've thought about that. I've thought of being and talking to a counselor, and I did for a while, but I imagine going into one now and saying, okay, my daughter died 4 years ago. One of the things she said was, I can seem to help everyone else, I just can't save myself. I've given TEDx talks, I've done this and this and this. Let's see what the cards you have are. Put them out on the table now.
Yeah.
And I don't want to hear how you've counseled others. I want to hear how you've counseled yourself.
That's a good point.
Some of the things
I
that
never
you
thought
have
about that
been
with the therapist.
through.
That's
Yeah.
interesting.
So, and it's not a zero-sum game type thing, but it lets them know that you expect them to have a heck of a lot of credibility and experience, and if they don't, you're going to dump truck them. And there was a counselor here in town that Morgan said, Daddy, I don't know if I should continue to go to her, because I can talk about anything I want and I can just run over her.
Yeah.
So,
And a lot of teenagers do that when they go to therapists.
you know, at $200 an hour, I thought, Morgan, what a great idea. Let's not go back to her.
Let's find somebody else. So
Okay.
that's what I'm saying. It sounds like this gentleman's going to be a really good fit for you, and compliments to you, to what Kathy said, going public with
Absolutely.
the situation so early. So
Yeah. Yeah.
And people here in the North Texas community, we do have some fabulous counselors, therapists,
We do.
psychologists, psychiatrists, people like Vanita Halliburton has
Oh,
an
yes,
extensive
yes.
list, and Philip Van Gilder does as well. Friends
Oh,
at
great guy,
ERC and Chris Getz, make calls, reach out, get help, because the life you save really will be your own, as contrived and as that is to
True,
say.
though.
It's
Yeah.
true though.
So the best advice comes from those who have the wisdom and the knowledge from the experience that they had to go through and can now pass that on. We're entering the holiday season, Steve. We're at the end of time today. Let's leave everybody with your wisdom and your advice as they enter into the holiday season.
We're coming out of a time of isolation and fear, anxiety, depression.
Yeah.
And it's perfectly okay to respect COVID, but you don't have to run in fear. Make smart plans with your family, with your siblings, with your kids, and embrace the incredible love that will be surrounding you. And just reach out, talk. And giving. Instead of running in to see the football game right after you eat, sit around the table and say, okay, we're living, this past year has been absolute heck, but say one thing that has given you hope or love or that you're thankful for, and go around and have everyone do that. And if you do, you're going to just put yourself in a better place, so when December comes along, you slide into the month with more a feeling of hope and renewed faith and love.
All right, with that, let's get us out the door. Great advice. Want to thank Steve Dunn and Patty Gillette for coming in with the mental health moment, first of all.
Yes.
And let's getting it back fired up again. I mean, what a time when we absolutely need it. And Steve, again, the more knowledge and experience you can pass on personally, the better people are off, because it's coming from somebody that's living it versus someone that may be just advising it who's never had to live it at all. And so I've only had a very small touch, thank God, with losing my mother. And still, I'm still spinning.
That's not a small touch at all.
Yeah, I'm still spinning. So my dad is still spinning. Yeah. And so, but lots of respect and appreciate what you're doing and what both of you are doing to bring this to the forefront and to the top. And again, Acadia Healthcare as well for sponsoring the mental health moment. So with that being said, we will see you on Wednesday. That day is full of politics. So buckle up.
Nothing to talk about.
And get ready to
Nothing
go.
Nothing to see here, folks.
Yeah, court cases and all kinds of fun stuff taking place. So Wednesday, gear up, get ready, because we're loaded. We're loaded for bear.
We are.
For sure. All right, we're JP Cathy and the crew on the JPK Broadcasting Network. You can find us at jpkcrew.com. That is jpkcrew.com.
Love y'all. Have a blessed day. Mwah.
And hook 'em horns. Yeah. You read my mind.
I knew y'all were going there. Thank y'all so